Hello and welcome to MedCity News' Pivot Podcast. I'm your host, Arundhati Parmar. This is the launch of Season 4, which focuses on turning data into insights. I'm very pleased to introduce Dr. Rowland Illing, Chief Medical Officer of Amazon Web Services, who will describe how AWS's Health Data Lake is powering new innovations in healthcare. Hello and welcome, Dr. Illing, to MedCity's Pivot Podcast.
Thank you so much for the invitation. Really appreciate it and honored to be on your inaugural podcast of the new season.
Okay, perfect. So let's start with this idea of the Health Data Lake, which AWS has. We've heard a lot about it. I just wanted to get an understanding of what kinds of data are sitting in this lake. So let's start there.
I'll take one step back if you don't mind, and
Sure.
just talk a little bit about when you talk about a health data lake, what do we mean by that? So, as you know, AWS is the largest global cloud computing company. We've been working specifically on cloud computing since 2006, and we've been diving very deep into the healthcare and life sciences data space. So we're working with customers of all kinds, so national governments, state governments, research organizations, hospital networks, payers, as well as health technology companies that support them. Then the life science space across medical device companies and biopharma companies. So we've got a vast array of end customers that want to consume technology, as well as the ecosystem of organizations that build solutions on top. Now, health data lakes are generally lakes full of healthcare and life sciences data. AWS has been building that infrastructure to provide the technology for data lake generation. So actually, how do customers build data lakes that have all the attributes that you want from infrastructure to support it? So namely security. So security is job zero. Resiliency. So if it does break, how quickly can it come back up? And then scalability. So if you're processing lots of transactions or ingesting lots of data, it's got to be able to scale effectively. So those key attributes are what we really double down on. So we've been democratizing access to compute, storage, and networking for many years. What we want to do is now really democratize access to analytics and generative AI on top. So building a lot of tools on top. So we've been building out the tools to build these health data lakes. And one of our services, so we tend not to build end-to-end solutions, that is customer-facing solutions like electronic medical records or PACS systems, especially just to look at imaging. We build services. And so a service is essentially a building block. It's a component of a solution that can be used by builders to build those solutions more easily. And it's a managed packet of code. It's a software package which has specific functions. So what we've been looking at data types. So we're thinking about health data in text data, imaging data, genomic data, and auditory data, as in that kind of transactional ambient listening data.
Okay, but no. Did you say claims data? Is claims data part of this or no?
Yeah, so claims data isn't a specific data type. That is a data type which is ubiquitous. So claims data itself is just financial data, which we have services for. We have all of our services we've got over 300 different services. Those services can manage claims data anyway. We've got healthcare data specific services around those I mentioned.
I see.
So when it comes to building a health data lake, you want to ingest all of these different types of information. And so AWS Healthlake, as we call it, actually you can think more of it as it's a data ingestion and normalization engine. And so it can take structured and unstructured text data, ingest it, and put it into a FHIR format. That's a fast healthcare interoperability resources format, which can then be passed by analytics and Gen AI and can be streamlined into you can put it into SageMaker, for instance, and build generative AI models on top. But so even though it's called AWS Healthlake, it's actually a fire in, fire out data normalization engine, you can consider it.
Let me ask you a clarifying question. When I think of a lake, I think a decent sized body of water, right? So if I'm your customer and I'm a life science company, do I have access to only my data lake based on the data that I have fed, or do I have access to a unified lake where other companies have put in their information, whether it be other life science companies, other providers, payers, or is it I'm only building tools on top of the information I give to AWS?
So again, I'll go back to that very founding piece, that kind of that principle of security. And
Mm-hmm.
so we have to be very, very sure, make it very clear that the customer's data are their own data. And
Yes.
so no one else has access to that data unless access is provided by the owner of the data. And
Sure.
that's true. So that's often the case. So for instance,
Yes.
when we're talking about things like claims data, it's very important that hospital systems share data with insurance companies and CMS to make sure that everyone knows actually the transactions are taking place. And so,
Right.
for instance, an example is the work that we're doing with Blue Cross Blue Shield. And so they wanted to build basically an enterprise data lake on AWS.
Mm-hmm.
They wanted all the consumers of that data then subscribe to that information, which is de-identified. And
Mm-hmm.
then so InterSystems, for instance, can consume it for claims processing. And
Mm-hmm.
as part of CMS's new interoperability standard, that aims to improve electronic exchange of health information between payers and providers, requiring them
Mm-hmm.
to implement APIs between data sets. And
Right.
so we are able to provide them with the tools that
Mm-hmm.
can ingest the text data. So we've got another service called Textract. And so
Right.
that can take text data, it can identify which bits need to be de-identified, and then the de-identified data can be put into AWS Healthlake, and that will both ingest and normalize the data and put into a timeline.
Mm-hmm.
And that will then go to something like helping a payer create a prior authorization engine. So talking about use cases which are important,
Right.
prior authorization for treatment is really important in the US. And
Mm-hmm.
so Southeastern Blues Plan developed a generative AI powered prior authorization recommendation engine, which was able to take that ingested data, and they were able to reduce the prior authorization processing time from days or weeks to less than 72 hours, which
Wow.
complied with CMS's mandate. So
Right.
it's very important that only the correct data is shared in a HIPAA compliant way with
Right.
those that need it.
Okay.
And we want to provide the tools for that.
So you gave the example for how payers are leveraging this data. Can you talk a little bit about how providers and how life science companies are leveraging their individual data lakes?
Yeah, sure. So again, we work with Rush University to create a population health analytics platform on AWS. So Rush wanted to address a systemic that they looked across Chicago, that's where Rush is based,
That's right.
and they could see that basically there is a 16-year life expectancy gap
Mm-hmm.
between minority and lower income residents of Chicago's west side compared to the
Mm-hmm.
rest of Chicago. And so
Right.
they wanted to really understand why that was taking place. So it's not just the healthcare data, it's also social data, it's
Mm-hmm.
cardiometabolic data. There's
Right.
lots of other data types that have impact into
Mhm.
that life expectancy difference. And so we help them build out the health equity care and analytics platform,
Mhm.
and that platform can transform, aggregate, and harmonize the data from these different sources,
Right.
and it'll actually allow them then to analyze that complex interplay of clinical and social factors on patients' health. And so it can aggregate data from HIPAA eligible sources. It can build a complete patient profile using clinical, social, and patient generated data, and then can provide risk scores and prediction modeling to guide clinical and community intervention. So again,
Right.
the ability to do that at scale, I think is very powerful.
Okay. Makes sense. And then the life sciences example, please.
Yes, of course. So for life sciences, there are many different use cases that life science companies want to address,
Mhm.
from early stage research and development, and that's including target identification if it's a new, what to point the drug at, or what target to point at, then drug discovery itself, then clinical trials, manufacturing, then commercial launch, and then obviously enterprise level transformation of the company. So to pick on a couple of these as examples, we have a great example for evolutionary scale, which I basically developed a biological foundation model to come up with a new green fluorescent protein as an example. So green fluorescence as a structure only developed once in evolution. And so most green fluorescent proteins in the world look pretty similar. They were able to build a foundation model that, looking at the active domain and how it worked, they were able to build a new protein scaffold around it, or come up with one, which only resembled it by around 57% of its DNA. And so they estimated that this would take about short-circuited evolution by about 500 million years, because that's how far back in the evolutionary timeline that would have diverted from what everything looks like today. But when we're talking about big pharma companies, 9 out of the top 10 global biopharmaceutical companies run on AWS. So for instance, when we're talking about generative AI for biology, we've got customers like AstraZeneca, Eli Lilly, Gilead, Merck, all building out their Gen AI powered platforms on AWS today. When it comes to clinical trials, again, we've got AstraZeneca, Eli Lilly, Gilead building out clinical trial platforms on AWS. And so where we see a really big impact of things like generative AI is this management of big data.
Right.
So again, I can give an example from Genomics England. So they had a biocuration service looking at identifying genes with clinical symptoms. So you can imagine globally the amount of clinical trial data or papers that are published looking at gene association with clinical outcomes, and not all papers are written in the same way. The level of association can be different. And so Genomics England have a team of around 40 biocurators that read all the literature looking for associations between genes and disease. We worked with Genomics England for 10 to 12 weeks to build out a generative AI model. So this was using a large language model from, this happened to be Claude from Anthropic. And then they used a prompt, which was all of the hundreds of thousands of papers, full text papers. And as part of a prompt into the large language model going, using all of these data, can we identify new gene associations for learning disability that previously were not identified? And so they were actually able to identify 20 new gene associations that were not previously known. And of those 20 gene associations, they've identified 2 which are going to go on for further study to actually see whether they can develop a genomic medicine against those things. So again, the ability to ingest hundreds of thousands of papers and make sense of it is a power of some of this technology that we're bringing to bear that really can scale and have impact.
I want to talk to you about clinical trials, because what you mentioned in terms of use cases by pharma companies is interesting, but a stumbling block in drug development is clinical trials and and how long it takes to recruit patients. So I was curious about this executive order that came out of the White House on pediatric cancer research and clinical trials, and I'm wondering whether there is sort of whether you have a perspective on how AWS and its AI capabilities can actually speed up sort of clinical trial recruitment and the way they're run.
Yeah, absolutely. So we are absolutely focused on oncology, pediatric cancer in particular. We've been working with the Children's Hospital of Philadelphia and over 35 other children's cancer centers across the US and internationally over several administrations now. And we the technology underpinning the Children's Brain Tumor Network. And the idea of the CBTN is to drive innovative discovery and pioneering new treatment for children with brain tumors. Now, the problem has always been that because these tumors are rare, aggregating data to make sense of to be able to identify targets and develop new treatments is difficult. Because if you're in a center that only has 1 or 2 patients a year, it's very difficult to get any meaningful scale. And so working with the Center for Data-Driven Discovery in Biomedicine, that's the D3B Center in CHOP, which kind of acts as the center for the Children's Brain Tumor Network. They were able to bring together studies, as I said, from over 35 different centers, covering 5,000 patients. And they used AWS Healthlake as a core part of their platform that they built it out. And so that then provides the ground truth of data, which can be used then by researchers to derive intelligence at scale from all of these different data sources to drive discovery.
Okay.
When it comes to clinical trials themselves, actually running decentralized clinical trials is really important as well. So we're looking at how then, once you can ingest lots of different data types to drive discovery at scale, how can we help run decentralized clinical trials?
Right.
And so one of those tools, so again, another service that we've launched is something called AWS Clean Rooms. So Clean Rooms is a technology where different organizations can put their data into a clean room, and the metadata is available. So actually the data headings, but the data itself, the row level data isn't available.
Okay.
And so it means that different pharma companies or different research groups can actually share data in a structured way so that all parties can access it and understand what's happening without sharing their underlying data. And so I think that's, again, a very powerful tool for companies and clinical organizations to share data at scale using this technology.
So I want to ask you about your competition, right? Microsoft has sort of data lakes. Google has its own data lake as well. How do you distinguish yourselves from them? Why would a customer come to you and not to them?
Well, again, we don't really tend to talk about our competition. I mean, we've been doing this for a long time. We are the largest and most scalable cloud globally. And I think it all comes down to security and resiliency. And so
Right.
we want to make sure that we are the most secure cloud running today, because healthcare data is a national priority, and
Mhm.
also resiliency. So if we're running clinical systems in the cloud, and that's running real-time electronic medical record, imaging, genomic data to treat patients in real time. So we have now whole hospital systems running all of their clinical data on AWS today. Geisinger Health, Tufts Medicine, they run their entire clinical workloads in real time on AWS. And so
Mhm.
it's really important that those systems don't go down. And so we're working very closely with Epic in the US. We're
Mhm.
working very closely with other electronic medical providers around the world, Daedalus in Europe, MV Systems in Brazil, to platform their systems in the most secure and resilient environments today. So
Mhm.
I think it's very important to differentiate Amazon's Healthlake versus the technology which our customers use to build their own health lakes.
Right.
So our customers are building out data lakes that include healthcare data and operational data and payer data and lots of other
Right.
data types. And we want to provide them with that lake house architecture, so
Right.
they're able to build out really resilient systems. And I said these services, so AWS Health Lake and AWS Health Imaging and AWS Health Omics, are component parts of the health lake, of the overarching structure,
Yeah.
which will enable our customers to build out highly secure, resilient, and performance systems.
So let me ask you this. The healthcare data has, there are a lot of people who talked about back, I shouldn't say back in the day, this was only 2, 3 years ago, but data janitors, right? The idea that the data that health systems have is not clean, that there are duplicates, there's just messy data, there's inaccurate information. They're giving you all this information with the hope that they'll be able to leverage it and create a tool that works. But have you ever encountered a situation where the data that they provided was just not up to par and you had to go back to them and say, hey, you need to have better either structured data or something better to be able to create a useful tool instead of just jumping on and doing something because everyone else is now using the data lake?
So part of what we do is work with end customers directly, but also through partners. And so
Okay.
it really depends upon the end user's capabilities in terms of building out secure infrastructure and analytics and Gen AI tools on top. So if we're working with a large end customer, a government agency, for instance, so we work very closely with CMS. They will have their own partners, their own systems integrators who will be able to build highly scalable and resilient insurance marketplaces online themselves. A lot of hospital systems will take things off the shelf,
Right.
and they'll require solutions. I think we will be able to offer guidance. So we have white papers, we have our own solutions architects. We can advise customers how to build in a secure way. That's what's called a well-architected framework. And we will also give advice where needed. So a lot of our discussions around data strategy and saying, how can we think about building systems which are will provide the level of granularity and deduplication as is necessary. But we're very clear that it's not a technology problem often. It's actually a way that data systems are set up. There's a lot of legacy involved. How can we, how can we make sure that we've got the right mindset of the leadership in any organization we work with? How can we make sure the leaders are aligned on innovating in a new way? Building in the cloud is different from building on premises. So how can we make sure that the leadership are tuned into that? How can we make sure that the people involved in delivering IT services to those end customers and in health technology companies are trained appropriately to actually use the tools that we have available to them? And then how can we think about the pathways in terms of that data ingestion in order to make you have the right outcome? Technology is at the end of that, but a lot of the steps involved, again, 97% of data, healthcare data, is thought to be unused because it's trapped in silos, it's trapped on premises, it's in PDF documents, it's unstructured. So a lot of those challenges is actually, how do we take away a lot of the manual, the heavy lifting? So I'll give you an example, which is Elevance Health. And so they wanted to have an intelligent claims processing service. It manually took 20 minutes per claim to manually extract that sensitive information from data that's being sent to them. We used Amazon Textract, so this service that can basically take text data and take out the PHI, the patient identifiable information, and then automate the claims process. They built out an end-to-end system using our services, and they used optical character recognition to extract that data from claims and forms and apply machine learning to index and classify each document. And they were able to extract and digitize, to process thousands of claims each day. So they're able to automate 80% of that claims processing workflow, and they expect it to reach over 90%.
And what about accuracy of these tools?
So in terms of, again, a lot of it depends on how the tool is used in reality. So it's difficult for us to give a very specific number for as a whole. I think when you have to see these tools when they're built into solutions, how accurate they are and how they can be tailored to improve things. So again, an example, again, a lot of it's around how you build those end-to-end solutions. So we work with Greenway Health, and they wanted to build out a new electronic health record on AWS, using AWS Healthlake as that engine underneath. And so their legacy API, that application programming interface, struggled with third-party integration and the data volume that was coming into it. And so it needed a scalable FHIR solution. So that's why they had to centralize that clinical data from 2 different EHR systems. So they migrated to AWS Healthlake, and they were able to ingest 9.5 billion FHIR resources error-free.
Wow.
And so, they projected it was going to save them about $1.9 million in projected cost savings. And, they were able to migrate 638 clients in under 1 day. And so again, I think that's the kind of scale that we can bring. But again, architecting things correctly is really important.
So final question, it used to be that people were really afraid of AI. I mean, I think there's still some legitimate concern, but for the most part, people have realized this is not something that they can shy away from, that they need to adopt and use. So I'm wondering, with that shift, especially from the provider perspective, have you seen a different, maybe smaller sized and mid-sized organizations now approaching you from the healthcare world, be it providers, payers, whoever, and using your services compared to, say, I don't know, 5, 7 years ago? Do you think the hesitation is sort of melting away?
Yeah, I think there are two things there. I think one is a move to cloud, which I think there's a lot of caution about moving to cloud,
Yeah,
certainly 5 or 6 years ago.
correct.
And then there's the caution around generative AI. I think
Mhm.
we've seen a massive shift to cloud. I think organizations in that first instance have gone from being cautious about cloud to realizing that actually security, scalability, and resiliency is just better now
Right,
running in the cloud than not. So we've seen all of the major global banks all move on to the cloud for
right.
those reasons.
Hmm.
National security and defense organizations run in the cloud today. So I think we're overcoming that barrier to cloud adoption, and we're seeing a massive uptake in both electronic medical records, imaging, and genomics. So again, we're working with most of the global imaging providers. So GE Healthcare,
Yes.
Philips, Intelerad, Agfa, they're building their solutions on AWS today. The genomics companies, the genomic sequencing companies like Illumina
Right.
and Ultima, they're building out their genomic sequencing pipelines on AWS. And we're building out a whole bunch of foundation models now in AWS around multimodal foundation models. For instance,
So,
Hopper as an imaging foundation model, G is building out imaging foundation models, Harrison AI. And so the first hump is to get cloud adoption. I think that's now we're getting into the adoption curve, going,
right.
is that inflections a hit?
Hmm.
AI adoption in healthcare has been really led by radiology. So my background is imaging, so that's
Right.
I've got a particular passion for that, and so
Hmm.
seeing the broad adoption of AI, over the last, I would say, 7 or 8 years, there are over 1,000 medical software as a medical device
Yes.
uh, applications now approved by the FDA
Okay.
for
Sure.
use in clinical practice. So again, I think that's a kind of indicative that we're seeing more and more applications coming in that are suitable for, to have AI embedded into them. And the really interesting thing that's happened recently is the use of ambient listening. So the ability to take
Conversations.
clinician
Yeah.
and care provider conversations and put them into natural language, and
Hmm.
also consolidate large medical records and clinical notes into summarization. I think that's really where clinicians have really been first exposed to the power of AI at scale. But
Right.
there's a whole ton of stuff at the back end, so all the operational stuff that's
Sure.
taking place in terms of figuring out operational uh, workflow management that I think is really key. And again, I say the patient provider interaction is also really important. So
Hmm.
how customers interact with, or patients interact with health systems, is fundamentally changing based upon their interaction with AI. Because it's not just doctors and care providers that need to adopt AI. It's also patients being happy to engage with AI as well. So,
Yeah.
for instance, in clinical communications, we have another service called Amazon Connect, and so that's really, how you can optimize patient engagement with health systems is really important. So we launched Connect in a 550 bed hospital, Jupiter Medical Center in the University of Texas, and
Hmm.
they're able to change their legacy contact center infrastructure completely. They had a you know an appointment backlog of over 1,800 patients. They had an over 9% abandon rate, so patients would call up and in almost 10% you just put the phone down.
Right.
And so they were able to develop a comprehensive bottom-up workflow change powered by Amazon Connect, which has got AI built into it. And they were able to cut their backlog of appointments down to 60% in the first three
Yeah.
months and reduce costs by 30% and get their abandoned call rate down to under 4%. So again, just that operational efficiency and putting AI in the background makes a real difference to the way that patients interact with systems as well. And I think as care providers and health systems will see those benefits, we'll get more and more adoption.
Any closing thoughts?
I think we are in the middle of a transformation of healthcare and life sciences. I think AI will impact everywhere. We haven't even talked about agents. So agents are another particular passion of mine. And that's
Right.
really the next level.
What's the next
I
level?
think we're seeing a lot of work around that foundational data planning, around kind of what the data infrastructure looks like, the data strategy.
Right.
We're seeing AI adoption at scale across both healthcare and life sciences. It's just here. It's happening.
Right.
And again, we just need to make sure that everyone's got the right skills to use the tools. And then the next generation of agents and about agentic workflows, so autonomous pieces of software that can
Right.
actually achieve their own ends. Again, we've built out services. So Amazon Bedrock is the service that can allow access to these foundation models at scale using guardrails and make sure that they're secure. So if you give data to the foundation model, it doesn't take it. It's actually, you can enrich those foundation models in a secure way.
Yeah.
And then build agents on top. So we just launched a service called Agent Core, which will allow providers, payers, and health technology companies to build the next generation of agents. And I think that is where it's going to make a huge difference.
Well, Dr. Illing, thank you so much for taking the time to talk with us today.
Absolute pleasure. Thank you for having me.